Welcome to this Prep It instructional presentation on the cost module. This is part of a series of presentations on the use of the various features in the Prep Implementation, Planning, Monitoring, and Evaluation tool, or Prep It. Prep It is a decision-making and analysis tool with several interrelated modules used for target setting, costing, and commodities forecasting. This presentation is the 7th in a series of presentations on the features and functions of Prep It. Understanding the costs of prep is useful for budgeting, planning, and examining cost effectiveness. In Prep It, costs are organized by visit type, and the tool uses continuation rates in combinations with visit schedules to calculate costs. The cost module, if completed, works with the targets module to provide the total cost needed to reach the determined targets and the cost per HIV infection averted. Since most clients stay on PrEP for less than a year, the costing module can provide an estimate of the cost per person initiated, which is lower than the cost for a person to stay on PrEP for an entire year. Before completing the cost module, it's important to consider what your aim is in estimating PrEP costs. Some potential reasons for using the cost module are to estimate a budget for a specific funding source, or to look at costs across all different funding sources, or to use for advocacy or new grant applications for new funding. Alternatively, to answer a variety of strategic decision-making questions around the costs of PrEP. How you want to use the costs results really informs what you should enter into the tool for this module. The first place that costs come up in Prep It is in the Methods section of Configuration, where the PrEP product costs are specified. There are default unit costs for pills, ring, and CAB PrEP. Users can overwrite the defaults with their program-specific unit costs. Note that the PrEP product costs should include the procurement costs, including shipping and freight, but not service delivery. The rest of the costs are specified in the costing module, where costs are entered separately for different methods. Make sure to select the drop-down menu and review the costs for each method, as making changes to one method does not cascade over to other methods. There are 3 different types of costs. First, monthly costs, including the previously specified commodity costs and other monthly costs, such as adherence support. Then there are costs per visit. This is both for initiation visits and continuation visits. Third, there are annual lump sum costs for things like training, demand creation, and other above-site costs. Because unit cost data can be hard to find, this tool has country-specific default values. These you can see in the reference drawer in the upper right corner of the costing tab. And these have defaults for serodifferent couples, key populations, and adolescent girls and young women. These default values are based on an analysis of 6 oral PrEP costing studies conducted in 6 countries. There are also defaults for PrEP ring and CAB, which reflect the best available data. In the defaults, capital and non-commodity recurrent costs are estimated as a % of other total visit costs. If you do have unit cost for your particular program, you should overwrite the defaults to best estimate the cost for your program. The unit costs shown in the defaults are in US dollars. If preferred, you can convert these to your country currency when you enter them in the tool. The tool does not automatically do currency conversions. When entering the cost data, you can use the checkboxes to indicate the cost components you want to include in your estimate, depending on your purpose for use. Note that the cost categories are the same for the initiation and continuation visits, so you should be consistent in deselecting the same cost components for both types of visits. Additionally, make sure to make these selections for each method, as the checkbox selections do not cascade over to the other methods. In this example, the user does not want to include adherence support, capital costs, or annual above-site costs in their estimates because they are covered under a different budget. So they have unselected these components. The default costs for standard priority populations will appear in the table automatically. These should be overwritten with your setting specific costs if that data are available from a costing study or other analysis. Note how in this example, the custom population truck drivers does not have default costs. In this case, you should copy over the cost inputs from the most similar population in terms of the resources needed for the provision of prep. If one didn't have specific cost data for truck drivers, for example, they might use the MSM or other data for this particular column. If you make changes to the costing inputs and later want to revert to the defaults, you can restore the defaults by clicking on the Reset to Defaults button. Depending on your costing purpose, you should consider whether above-site costs, such as training, demand creation, and management, should be included in your cost estimates. Lump sums are not population specific and do not directly depend on the number of prep clients. While the main costing table allows one to enter one number for lump sum costs, these should only be entered if you have lump sum costs that are specific to the prep method currently displayed in that table. Lump sum costs that contribute to the entire prep program, regardless of method, should be entered in the lower table. In this table, you can select if you want lump sums as amounts or the percentage of total site level costs per year. The tool is set up with common above site categories. These can be renamed, and you can use the Add Category button to add more categories if needed. Once you've completed your inputs, you can find the results on the Results dashboard, which will display the annual unit cost per person staying on prep for a year and the annual unit cost per initiation, which factors into the continuation rates. Use the drop-down list to show the results by different methods. Note that the annual unit costs shown here are excluding lump sum costs. If you are using the cost module but not generating targets, the results will not include lump sum costs because the program needs to know how many prep clients to spread these costs over, which are only calculated if one generates targets. If you have generated targets, you'll be able to see the annual unit costs with and without lump sum costs. Once you've set targets, you can also see the total costs and the cost per HIV infection reverted for your targets for each priority population. The next slide will show a demonstration of inputting data into the cost module and reviewing the results. So here we are back in configuration, and at this point we've completed all our configuration steps. You'll remember in methods, we first encountered costs when we specified the commodity costs, both for oral and cab prep. So that gets factored in when we move on to the cost module. So here are a few things to note with the cost module. You'll see that there are values already populating the tables based on our default cost patterns. And there are the different categories of costs that we mentioned. The cost per person month, that is our commodity costs, which were specified in the method section, and adherence, support, and other monthly costs. Then we have our cost per visit. Those are both the initiation visits and the continuation visits. And then we have annual above-site lump sum costs. And then additionally, we have, if we want to do further specify our lump sum costs, we have a second table in which we can do that. Now notice here that the gray rows are either formulas or data that's been brought in from the methods section. So we don't have to do any inputs there. But with the light yellow or cream rows, that's where we have to put in data. And our first step is to decide, based on what we're doing with this tool in terms of costing, Which of these elements are we going to include in our costing exercise? So in this example, I'm going to say that adherence costs, support, that's not something we're including in our estimate. And I'm also going to say, for example, we might not be interested in capital costs. And if I deselect capital costs, even if there's values in this row, they won't be included in the overall costs. It's important if you deselect in something in the initiation visit, you should also deselect that in the continuation visit as well. Let's take a look at our default cost patterns. You can see them here. This is for oral prep, showing them for serodiscordant couples, key populations, and adolescent girls and young women. And basically what the tool does is for the priority populations that we set that were default priority populations, they know the appropriate value to pull in from there. However, for our custom population, in this case Fisher folk, the tool doesn't know what value to pull in, so you need to copy over the relevant data. Now keep in mind, if you have done a costing study and you have this data for your specific program, you should overwrite all the values with the data that you have. But if you don't have that, then you can maintain these defaults and just make some adjustments as necessary. Maybe you know that you're going to use the defaults, but you know that your labs are higher in cost or lower, and so you can make those adjustments accordingly. I'm going to go ahead and copy over the key pop data as my best estimate for my Fisher folk, understanding that there are differences between these populations, but this is our best estimate at this time. I'm not going to bother with capital costs since we're excluding it, but again, had I entered a value, it would just not be counted when it does the total cost calculation. Okay. In terms of above site costs, I'm going to deselect it here as in terms of one line and be more explicit down into the subsequent table. So you could rename these categories, you can add categories, or you can delete the categories. I'm going to just specify some training costs, and I'm going to do it for the first 3 years. Okay, so now we've completed our cost inputs for oral prep. Keep in mind, if you have more than one method, you need to repeat that process for your second and third methods. So again, I'm going to deselect both our adherence support, the capital costs, and the above site. I'm going to copy over the values for my Fisher folk category. And again, the defaults for CAB are based on the best available data. And I'm going to increase the training costs for the first year for CAB prep. Okay, so now that we've completed that, we have to generate targets to then see the costs associated with our targets. But if we, at this point in our application, we have not yet generated targets. But if you go to the results dashboard, you can see that we have the cost per person to stay on prep for an entire year, as well as the cost per person initiating prep, which accounts for the continuation rates over time. And we toggle this for both oral and CAB prep to see those numbers. Note that this excludes the lump sum and above site service delivery costs. If you set targets, then it allows to spread those costs over the total number of people in your targets so that data become available. But prior to setting targets, it's only going to tell you those costs excluding the lump sums. We'll see more of the costs related to targets once we've completed the targets module. For more information on the costing module and other functions of PrepIt, please join the PrepIt community of practice. You can enter questions with the hashtag costs so that others can learn from your question as well.